Let's, hi, everyone. Thank you for joining us this early Friday morning for today's legislative update and training webinar concerning the Colorado Prescription Drug Monitoring Program. This meeting is hosted by the Division of Professions and Occupations at the Colorado Department of Regulatory Agencies. My name is Justin Whip. I'm the program analyst for the Colorado PDMP. I have our PDMP administrator, Gina Sanchez, assisting with the webinar at the moment. I believe our senior program director for the State Board of Pharmacy and the PDMP, Dimitri Kunin, will be joining us a little bit later in the webinar to assist as well. I'll let you know that attending this live Zoom meeting does qualify for 1 hour of the substance use prevention training that's required during the Colorado license renewal for opioid prescribers, but this is not a formal continuing education course and is not eligible for any continuing education credit. Those who do attend, we're essentially tracking those who have attended. If you do try to claim this for the substance use prevention training, essentially you attest that you completed that training during your license renewal. And then if the board does audit you and ask for documentation that you attended, just go ahead and let them know that you attended this and we'll be able to validate that for you. So just quick housekeeping, the webinar will start with about 25-minute presentation regarding legislative updates, Colorado controlled substance prescribing requirements, authorized PDMP access, and the PDMP registration and use mandates. And then we'll also cover some frequently asked questions about how to use the PDMP and some issues you might encounter occasionally with the program. We will have a break there for questions and answers. And if you do have questions, you can submit those through the Q&A link. And the second portion of the webinar will be about a 15-minute presentation going over the PDMP Aware web portal registration process and some of the key features of the PDMP Aware web portal. If you're someone who's using the PDMP typically through your EHR, pharmacy management system, where you're just clicking a shortcut into a patient's PDMP profile, you might not be aware of some of those key features that are available in the web portal. So hopefully there's some useful information in there as well. Again, we'll be posting a copy of these slides as well as a recording to the DORA PDMP webpage that we have there below. So first, I want to mention Colorado Senate Bill 24047, which is the Prevention of Substance Use Disorders bill. So this bill has several provisions in it, several that relate to the PDMP, some that do not, but we'll touch on the PDMP related provisions here. So first, this authorizes but doesn't require practitioners who have a prescriptive authority license but don't have a personal DEA license to access the PDMP. There is a specific role those people have to register under, which is the prescriber without DEA role. It also authorizes medical directors of a medical practice or clinic or hospital or their delegates to access the PDMP for any current patient of that medical practice or clinic or hospital. We don't use a specific role in there. It's essentially just an additional context in which a physician or nurse practitioner who is working as a medical director can access the PDMP. There are also authorizations for the executive director of the Colorado Department of Healthcare Policy and Financing to access the PDMP for purposes of care coordination, utilization, review, and federally required reporting pertaining to their beneficiaries. And the bill also exempts veterinarians from the requirement to query the PDMP before prescribing certain opioids and benzodiazepines, as well as the related days supply limits on first opioid and benzodiazepines for those veterinarians. The other bill that somewhat touches on the PDMP is Colorado House Bill 241045, which is the Treatment for Substance Use Disorders bill. This bill has, again, several provisions that don't relate to the PDMP, but it does grant prescriptive authority to pharmacists to prescribe FDA-approved medications for opioid use disorder, which would include Schedule 3 through 5 controlled substances, which currently would be buprenorphine. I do want to note that the pharmacists do need to obtain a DEA license in order to prescribe buprenorphine for opioid use disorder. We are working on a special credential for those pharmacists who wish to obtain a DEA license. There's also a related statewide protocol that's in development, which must be approved by the State Board of Pharmacy in consultation with the Colorado Medical Board, Board of Nursing, and the Colorado Department of Public Health and Environment by May 1st, 2025. We did present the initial draft of that to the medical board yesterday. They had a lot of feedback, so that will be working its way through the process, but I do anticipate it will be finalized before May 1st. I want to also call out some significant changes to the PDMP, which occurred in 2022. There was two bills that both had this provision in it. Essentially, it's a significant expansion of the PDMP use mandate in advance of certain opioids and benzodiazepine prescriptions. So currently, a prescriber or now their medical director or their delegate is required to review the patient's PDMP report for every opioid prescription, except for the following scenarios: if the patient's receiving that opioid in a hospital or skilled nursing facility or residential facility or correctional facility, the patient has chronic pain or cancer-related pain, post-surgical pain expected to last more than 14 days, or is undergoing palliative or hospice care, or patients receiving just a single dose of an opioid to relieve pain for a single test or procedure. And again, with Senate Bill 24047, this no longer applies to veterinarians. Then the benzodiazepine use mandate. Essentially, the prescriber or their medical director or their delegates required to review patient's PDMP report before prescribing any benzodiazepine, unless that benzodiazepine is prescribed to treat either a patient in hospice, or epilepsy, or seizure disorder, or suspected seizure disorder, or spasticity, alcohol withdrawal, or a neurological condition, including post-traumatic brain injury or catatonia. Just want to also call, if you have any questions, please submit them through the Q&A link. We won't be calling on folks who raise their hands through the presentation. There's also a PDMP use mandate in terms of the enforcement. I want to call out that one, the Colorado PDMP doesn't have the authority to unsolicitedly or proactively notify a licensing board of a practitioner's compliance with the PDMP use mandate or with their prescribing behavior. That's something that can only be subpoenaed by a board if they have a bona fide investigation against a practitioner, and that investigation would need to come from a complaint from another source outside of the PDMP. And then additionally, failure to comply with this use mandate is grounds for unprofessional conduct only if the practitioner repeatedly fails to comply, and the violation of the use mandate doesn't create a private right of action or serve as the basis of the cause of action by itself. There's also some limitations on first opioid prescriptions that I want to mention. These are not new. The opioid prescription limit was actually put in place in Senate Bill 1822 in 2018, which is essentially a 7-day opioid supply limit or day supply limit for a patient that's not received an opioid prescription from that prescriber within the last 12 months. The law does allow prescribers to exercise discretion to include a second fill for a 7-day supply, but it should be noted that 7-day supply does not apply, that 7-day limit does not apply in several circumstances, such as following transfer of care from another prescriber who practices the same profession and who prescribed an opioid to that patient, or if in the judgment of the prescriber that patient has chronic pain or has cancer-related pain or post-surgical pain expected to last more than 14 days, or is undergoing palliative or hospice care. And again, the Senate Bill 24047 this no longer applies to veterinary prescriptions. Then there's also a limit of on the first benzodiazepine prescription, which was enacted in 2021. And the day supply limit actually was enacted through each prescribing board's rules. But this law requires that a patient who's not obtained a benzodiazepine prescription from any prescriber within the last 12 months shall not be prescribed more than a 30-day supply of a benzodiazepine unless that benzodiazepine is prescribed to treat either epilepsy or a seizure disorder or suspected seizure disorder or a spasticity or alcohol withdrawal or a neurological condition, including post-traumatic brain injury or catatonia. And again, no longer applies to veterinary prescriptions with legislation from this year. I want to also mention legislation from 2023, which was the opioid prescriptions for chronic pain bill, Senate Bill 23144. This bill essentially provides some protections against disciplinary action for practitioners who are prescribing high dosage opioids to patients who are on the high dose. Essentially, the law states that a practitioner is not subject to disciplinary action by the regulatory board for appropriately prescribing, dispensing, or administering a controlled substance in the course of treatment of a patient for chronic pain if that healthcare provider keeps accurate records and prescribes those medications in accordance with a legitimate medical purpose in the usual course of professional practice. also states that a practitioner acting in good faith and based on the needs of a patient with chronic pain is not subject to discipline from the regulatory board solely for prescribing a dosage with a higher morphine milligram equivalent than those that are recommended in the state or federal opioid prescribing guideline or policy. Bill also prohibits a pharmacy carrier, pharmacy benefit manager, healthcare practice, or clinic from enacting any policies that would require a pharmacist to refuse to fill an opioid prescription or would require a practitioner to refuse to prescribe or administer or dispense a prescription solely because that prescription is for an opioid or because that opioid prescription exceeds a predetermined morphine milligram equivalent recommendation or threshold. Or additionally, before treating a patient with chronic pain, the law does state that a practitioner must discuss with the patient or the legal guardian the risks associated with that controlled substance and shall document that discussion in the patient's record. If you are a controlled substance prescriber, I imagine you're already aware that electronic prescribing of controlled substances has been a requirement for most prescribers since July 1st of 2021 and for dentists and rural prescribers since July 1st of 2023. But in brief, any non-veterinary prescriber is required to electronically prescribe a Schedule 2 through 4 controlled substance unless there's a technological or electrical failure at the time of issuing the prescription, or the prescription is to be dispensed at an out-of-state pharmacy, or if that practitioner is directly dispensing the controlled substance to the patient, or if that prescriber writes 24 or fewer controlled substances per year, or if they demonstrate economic hardship in accordance with the rules adopted by their board. There's essentially an economic hardship waiver that needs to be submitted to the board in that situation. There are some much less common scenarios that are delineated in the law, but too convoluted and long to be mentioned here. I also want to note that a pharmacist who receives an order for a controlled substance that's not transmitted electronically is not required to verify the applicability of an exception to that electronic prescribing of controlled substances requirement. That's noted in the Pharmacy Practice Act in Section 12-281-23-1B. And I do want to mention who's authorized to access the PDMP and in what context. So a practitioner who has prescriptive authority license here in Colorado can access the PDMP for any current patient. The medical director, which doesn't need to be either a physician or nurse practitioner of a medical practice or a hospital, can access the PDMP for any current patient of the practice or hospital under that director's supervision. Pharmacists are able to access the PDMP for any patient to whom that pharmacist is dispensing or is considering dispensing any prescription drug, or that a patient that they are providing clinical patient services to. Veterinarians are also authorized to access the PDMP for any current patient, which would be the animal. There's also an allowance to access the PDMP for a client if, in the exercise of professional judgment, the veterinarian has a reasonable basis to suspect the client has a substance use disorder or has mistreated an animal. And just want to note, a delegated user for a supervising practitioner or pharmacist is authorized to access on that supervisor's behalf in those above contexts. Want to also note the PDMP registration requirement. So Colorado law does require all Colorado licensed practitioners who have an active DEA license in any jurisdiction. So this includes those who are licensed here in Colorado but are not practicing in Colorado, or someone licensed here in Colorado and has an out-of-state DEA license, as well as all Colorado licensed pharmacists are all required to register and maintain user account with the Colorado PDMP through our web portal at colorado.pdmpware.net. This is especially important now with the DEA's waiver on needing to obtain multiple DEA licenses for every state in which a practitioner is doing telemedicine. So with that waiver, practitioners who are doing telemedicine in multiple states don't need to obtain a DEA license in each of those states, which makes it even more important for our folks who are currently practicing out of state to be registered here with our PDMP. Just also want to note that currently licensees have to attest during their license renewal that they're registered with the PDMP. We do anticipate some enhancements with our licensing platform here next year that will make it easier for us to validate PDMP registration and essentially ensure during renewal that someone actually is registered rather than using that attestation. Also just want to note, again, as we mentioned before, those PDP use mandates for certain opioids and benzodiazepines, those are all the base requirements for any practitioner or pharmacist. There are requirements for someone who wants to use a delegated user to access the PDP on their behalf that we do want to mention. So delegates can only access the PDP through the PDP Aware web portal. So if you have an integrated connection into the PDP through EHR pharmacy management system, obviously you can get to the PDP quite quickly and efficiently. If you don't have that integrated connection, having someone on your staff access as a delegated user might reduce the time and effort related to manually searching the PDP Aware web portal. But those delegates do need to be employed by or under contract with the same professional practice as the supervising practitioner or medical director, or the same pharmacy as the supervising pharmacist. Additionally, that supervisor must take reasonable steps to ensure the delegate is sufficiently competent in the use of the program. The delegates do need to register their own user account under the appropriate role of prescriber delegate unlicensed or pharmacist delegate unlicensed, and the registration will have them link their account to their supervisor or to multiple supervisors. We don't use a license-based role because Colorado law doesn't have any license-based requirements for delegated users. And since I believe 2021, there's been no limit on the number of delegates that a supervisor can have, and there are no limits on the number of supervisors that a delegate can have. Do want to also mention that the supervisor is responsible for ensuring that delegates are accessing only what's authorized and that their access occurs in a manner that protects the confidentiality of PDMP information. Supervisor is also responsible for any negligent breach of confidentiality of the information obtained by that delegate. And supervisor is also subject to penalties for a delegate's inappropriate access of PDP information, which consists of a civil fine of between $1,000 and $10,000 for each violation. And want to note that the supervisors do need to either approve or reject those delegates' access and do need to re-verify their delegates annually. That occurs during February. That's all done through the delegate management menu in the PDMP Aware web portal. So it's important to remove any delegates if they leave your practice so that you ensure that they are not continuing to access the PDP once they're no longer authorized to do so. We do sometimes get questions about, what should I do based on a patient's PDMP report? And really, the PDMP is just one point for clinical decision support, and practitioners should use their clinical judgment in determining whether to prescribe or dispense a medication. There really are not any prohibitions in Colorado law or regulations that would prohibit a practitioner from prescribing any medications based on what you see in the PDMP. I do want to mention those day supply limits on those first opioids and benzodiazepines in certain situations. And just as a disclaimer, our boards and our PDMP, we can't provide practice opinion or legal advice, so we can't always give you a further clarification on some of those items. Some folks may encounter that their PDMP Aware account was deactivated and may wonder why that occurred. So generally speaking, as long as your Colorado professional license remains active, and if you hold a DEA license, as long as that DEA license is active, the account should remain active. So if you, for some reason, allowed your Colorado professional license go into a non-active status, either you forgot to renew it during the renewal period, or there was some kind of action that inactivated the license, you need to work with the DORA, Division of Professions and Occupations Licensing Team, for assistance in sorting out what you need to do to get your license reactivated. Can also occur if you've allowed your DEA license to expire. I do want to note this happens to probably 10 or 15 people every month where they didn't renew their DEA license before the expiration date. And then within the 30-day grace period, they go to the DEA and get that reinstated. The DEA gives you 30 days after the expiration date to renew it, and it's essentially immediately reinstated. But if you allow it to go more than 30 days past expiration, they will make you apply for a new DEA license, which does take several weeks to process on their end. We do, at the end of each month, go back and see if anyone did have their DEA license reactivated within the grace period. But if you do that and catch it immediately and see that your PDMP account was not turned on right away, contact us, and once we can validate the DEA is active again, we can turn it back on. Some folks wonder why the PDMP would list your previous employer's address or maybe a home address or an old phone number on your patient's PDMP report. So if you're looking at a patient's PDMP report, you usually can see it'll list a summary of the pharmacies and the prescribers for that patient. That address information, phone numbers, are all pulled from your DEA license. So the DEA does expect practitioners to keep their practice location up to date with the DEA, and you would need to update that through your DEA account at dea-diversion.usdoj.gov. Also want to note that if you do go in and make changes to your DEA license, it does not go back to retroactively change the address on the prescriptions that were previously reported to the PDMP. I want to also quickly note there's some issues where if you're using the PDMP Gateway integration service, your access could be denied. You'll get an error message stating that the Colorado PDMP requires authorization and the request was denied for one of two reasons. If it says no provider match with the provided identifiers, that would mean either you're not registered with the PDMP through the PDMP Aware web portal, which is a statutory requirement for almost everyone that's using the PDMP Gateway service, or you may have a PDMP Aware account, but the credential being sent from your EHR to the PDMP, which is either your DEA or NPI number or state license number or a combination of those, isn't matching what's on your PDMP Aware account. So if you contact us for assistance, we can help with, adding or updating a DEA or NPI number, or, help address any formatting issues that might be occurring with your license number. If you get a message that the match provider was not active, that would mean that your PDMP account has been deactivated for one of those reasons we just mentioned. And again, contact us for assistance on that. There's also some issues with patient matching that you may encounter, especially through the PDMP Gateway service, which if there are multiple profiles for the same parameters that you sent, it won't return a result for you. So you'd see a message stating that based on the patient details submitted, your state PDMP cannot identify a unique patient, and it'll ask you to manually search that patient in the state PDMP website. So this would indicate that there may be multiple unconsolidated patient profiles for that patient that might need to be consolidated, or there could be multiple different people with those search parameters sent, which is a very common name having the same date of birth or very similar names in that same date of birth. If you search through the PDMP Aware web portal, there's ability to do some things to try to troubleshoot that, review the multiple profiles, and select which one belongs to your patient. I want to note that we do get those kicked back to us for review. We do try to consolidate those when we can, but we're not always able to determine whether those profiles should be consolidated. So if you come into that issue, please contact us for assistance, and we will assist with getting those profiles consolidated. Now, conversely, there is a possibility that two patients have been linked together that shouldn't have been. This is a little bit harder for us to identify, so we really do rely on our users to find these. If you're concerned that there might be two patients whose profiles are incorrectly consolidated, again, there's a patient matching algorithm that does this. It's not perfect, but it is pretty darn good. If you're concerned about prescriptions maybe not belonging to your patient, if you expand this linked records section here at the top of the patient's report, you'll be able to see the profiles that make up the PDMP report. So you'll see the name, dates of birth, etc. And then you also see the ID numbers, which correspond to this ID number that you'll see in the report. So if you find something inappropriately included in there, you can use that ID number to sort out which ones do and don't belong to your patient. We do ask for you to contact us for assistance in getting those separated. That this can happen if we have twins with very similar names, or two people with a very similar name or same name and the same date of birth. That's the most common situation that will occur. And then I just want to briefly mention, integrated PDMP access through your EHR or electronic prescribing software or pharmacy management system will allow you to get to the PDMP quite efficiently with a direct link in your workflow to the PDMP. If this isn't something that you already have, I'd recommend that you check with your IT team or your EHR vendor regarding compatible integration options with your platform. Most of the integrations are through our vendors, PDMP Gateway Service. Bamboo Health is our PDMP vendor. There is an interest form on their website, or you can also let your EHR vendor know that you're interested and they can start that process for you. We also have a few vendors, OPSafe, Logically, and PastRx, that are offering integration through a separate integration and interstate data sharing hub, which is the RX Check Hub. I just want to note we can't provide any recommendations on any particular product or service. So with that, I'm going to take a break here. Here are some useful links. I'm going to take a look at any questions in here. We've got a question on if Ambien and Linessa are included in benzodiazepines. So the requirement is not for sedatives. It specifically does state benzodiazepines. So essentially, if it is classified as a benzodiazepine, that requirement would apply. If it is a non-benzodiazepine sedative, then they do not apply, or that use mandate and limit does not apply. And the question of if you have a DA license and practice in Colorado but never prescribe an opioid or controlled substance, you need to sign into the PDMP for any reason as well. You do need to at least be registered. You have the authority to access the PDMP for any current patient. So if you ever do want to review your patient's controlled substance prescription history for any reason, not just if you're considering prescribing a controlled substance, you're able to use the PDMP for that. But the accounts themselves don't get deactivated if you're not logging in periodically. The passwords are good for 1 year. If the password expires, you just have to go through the password reset process. Essentially, password reset will let you get in there if you let the account or the password expire past the expiration date, but it doesn't turn the account off. I had a question on if you are not allowed to refuse an opioid prescription just because it's an opioid. That is not what the legislation states. I do recommend that you review that legislation, which is Senate Bill 23-144. The prohibition is on clinics from having a policy that would require a refusal to prescribe an opioid or based on just because it's an opioid or because it's above a particular dosage. So Monica, I would definitely recommend taking a close look at Senate Bill 23-144 there for the full statutory legislation piece there. It's also in section 1230-109, 109.5. Question on veterinarians. If you're required to advise a client prior to checking the PDMP, is required to document a PDMP search in the animal's record. All the law states is that you have the authority to access it for any current patient, and there's not a permission-based piece to accessing the PDMP under what's authorized. And then the client search is only authorized if, in the exercise of your professional judgment, you have a reasonable basis to suspect that that client has mistreated an animal or has a substance use disorder. Question about someone not being able to get into the PDMP web portal, would recommend that they contact us for assistance. Again, 303-894-5957, or our email address there. We generally do have to verify someone's identity, so giving us a call is probably the best way to go about that. I don't have an answer for Jillian's question there. So sorry. You can submit questions. If we don't get them answered here, we'll see what we can do, but I don't have time to dig into some of this stuff. Question on what if a pharmacist refuses a paper prescription? I've heard that sometimes occurs. Just note the legislation there that pharmacists are not required to verify the applicability of an exception to the electronic prescribing requirements, but there are also scenarios, a pharmacist does have the right to refuse to fill a prescription. So that's a little bit of a juggling act there, and I can't necessarily provide further practice opinion or guidance on that. With that, I'm going to go to the PDMP aware registration process. This is primarily for prescribers. The web portal is at colorado.pdmpaware.net. There's a create an account link right below the login section. If you select that create an account link, it'll have you enter an email address and create a password. Before going further, if you get this error message that the email is invalid, that would mean there's already an account under that email address. And so you'd want to either log in or reset your password to get logged in there. After entering your email, it will go to a role selection page. A few things to note here. The delegate roles again are all under unlicensed because we don't have any license-based requirement. We highly recommend you should not be using the out-of-state prescriber or out-of-state pharmacist role. If you are licensed here in Colorado, that will create some issues with your registration if you select that role and are licensed here. Veterinarians, if you have your own DEA license, register under the veterinarian role. This veterinarian resident role is only for someone who is working for the Colorado State University Teaching Hospital and is prescribing under that institutional hospital DEA number and don't have their own personal DEA number. I want to note the psychologist with prescriptive authority role is only for someone who has a specific psychologist with prescriptive authority license and a DEA license. Medical residents who have a physician training license should only select the medical resident role. If you select physician as well as medical resident or just select physician, it's going to ask for a personal DEA license. You're going to get hung up in that registration process. So only select medical resident. And then again, that prescriber without DEA role is a new one from 2024 legislation. That's for all roles that have a prescriptive authority license but do not have a personal DEA license. And then any person such as an advanced practice nurse who doesn't have that prescriptive authority license or a psychologist who doesn't have that prescriptive authority license is not authorized to access the PDMP under their own authority. So if you are a prescriber with a DEA license, the first thing it will ask for is your DEA number. You'll need to type it in there and make sure you click this add button for it to actually load the DEA number on there. If you have multiple DEA numbers, please make sure you're adding all of them on there. And you can put in an NPI and use this autofill to fill in some of the personal details, but it's not going to autofill your license information. Your professional license number is going to be just the number portion of what's on your wallet card. Do not want to include any leading zeros on that. So every license number has a letter prefix, period, 1 to 3 zeros, and then a license number. So dr.007123 would just be entering 71234 on the license number type. And then there's a pick list, on the license number, then license type is a pick list where you select that DR from all of the different physician license prefixes. There are some roles that have quite a few different license prefixes. The specialty information is required for a prescriber. You can either click browse all to see the full list or just start typing in this field and you'll be able to start seeing corresponding specialties that match that. Just want to note, if you do try to add your DEA number and get this error message that the DEA number has already been taken either by you or someone else, that would mean that you already have an account most likely. You want to contact the state administrator here to update your existing account. Some folks have questions about why the date of birth or why this last four social security number is required. So this is required to verify your identity against what's on your professional license. We do an initial account validation against your professional license information, and that is re-verified on a daily basis. Very important for security of the system there. Also want to note there is a requirement for a primary contact phone number. The mobile phone number is not required, but highly recommended. If you have a mobile phone number on the account, you can reset your password with a verification code via text message. The password reset via text can be especially useful if you register under a work email address and then you change employers, lose access to that login email. If you have a cell phone number on, you can punch in the current login email, even if it's not accessible, request a verification code via text message, reset your password, get logged in, and then you can update your password or your email once you're logged in to the PDMP Aware web portal. Just want to note there's a section for employer information, but again, this is not what displays on the prescription history in the PDMP. That all does come from your DEA license. That's why we don't have that as a required field, because typically find that the DEA license is much more accurate information on the PDMP account. Want to note, if you do log out and complete later, you'll have to go back in within 7 days to complete the registration. Do highly recommend that you just complete this all in one swoop. It should take no more than 2 or 3 minutes to get logged in there or to complete the registration. There's a page here that will tell you your account is pending approval if it's not automatically initially validated. If it is automatically validated, you'll see an end user license agreement. So if you see a screen like this most likely mean that your account didn't pass that initial validation, probably because you included leading zeros on your license number. So we do take those out and clear those out and resubmit that. So usually it's just a matter of getting those leading zeros out of the account. If there are other issues like your date of birth or last four social security number not matching, will be rejected. We do have a verification email that goes out, and highly recommend that you go through that verification process on your email address. Finally, want to quickly note the delegate registration process. So if you select a delegate role, it'll ask for your own information, and then at the bottom, it'll ask for your supervisor's information. The email you enter here does need to be your supervisor's PDMP Aware login email address. If you have multiple supervisors, just enter one, hit add, enter the next, hit add, and they will all load in there. Essentially, if you successfully add an email address for a supervisor, it will show below like this. If you get a message that the address provided must be for a user with prescriptive authority as a supervisor, that means that whatever email address you're entering there is not their actual PDMP Aware login email address. So highly recommend that you do get that information from your supervisor before you start your account, because again, incomplete accounts will be rejected after 7 days. You'll have to just start that over again. But if we do reject an account application, it frees that email address up to be used again in another registration. So for the delegates, again, we will approve the account if you've got at least one supervisor listed who's got you approved and you have submitted all the required information. But additionally, the supervisor has to approve you before you can make any searches in the PDMP on their behalf. And then again, there is an annual re-verification process in February. Your status would be kicked back to pending if your supervisor doesn't go in there during that re-verification process and revalidate you. Just quickly want to note the automated emails are going to come from no-reply@colorado.pdmpaware.net. That is things like your verification email, the incomplete account rejection, a password expiration notice, and an account deactivation notice will all come from those. So we sometimes get questions if those are legitimate emails, since it's not a .gov email address. And yes, that is our vendor's pdmpaware.net email domain that they send all their automated notifications from. Again, the DA licensed practitioner is already registered, can't create a second account. They'll want to contact us if they lose access to their old account login email address. And then, yeah, incomplete applications cleared out after 7 days, but you will be able to use that email in a new registration if it does get cleared out. And I want to call out some of the key functions and features in here. There's a dashboard on the homepage. This is sort of the default dashboard. You can make changes to your dashboard and how you want it laid out, but generally it will give you a summary of recent searches that you or your delegates have done. If you have any delegated users, you'll see them below. And then the patient alerts, which are not super common, but if you have any patient alerts, you'll see them as well as some key announcements. But all of the key features are through this menu link at the top left, and this RX search menu is really where most everything is found. So the patient request is where you can manually search. The PDMP Aware web portal requires only the fields that have a red asterisk, which are first name, last name, date of birth, and fill date. The partial spelling box does allow you to search with just the first 3 letters of a name. It does remove the date of birth requirement, but I'd only recommend removing the date of birth for a veterinary patient request. Veterinary prescriptions are reported to the PDMP in all kinds of different ways. I'd say it's supposed to be the animal's name is the first name, owner's last name is the last name. Obviously, there can be multiple owners. It could be multiple last names. The dates of birth are the most tricky one, though. Pharmacies may do whatever the owner tells them the date of birth is, or they may use a dummy date of birth, or they may just approximate a date of birth. Want to also note the date range can be changed. It's a default of the past year, but you can actually go up to 7 years back. And then the bottom section of this page has a list of additional states that you can search. So the PDMP Interconnect Hub is the default one, and you'll see over 40 states on that list. I want to note that, if you're querying all of those states, it will slow down the results, and sometimes we'll time things out. It's not super common to get them timed out, but it definitely increases the risk of that. Also increases the risk of getting a false positive match on a patient especially a patient who has a common name. There's also what I really want to point out that people don't often see is the second hub, the RxCheck Hub. This is a different interstate data sharing hub, and most importantly, our neighboring state, Nebraska, is only sharing data with other PDMPs through this other hub. So if you need to search Nebraska, you'll just have to select this RxCheck Hub before you can run that search. Utah, as you saw, is actually on both hubs, Interconnect and RxCheck. Kentucky is also only on RxCheck, but as it's not a neighboring state, that's probably less commonly requested. There's also an option of doing a bulk patient searches, so you can put in an entire list of names and dates of birth, create a group name, and then run that all at once. Or there's also an option of doing a file upload where you can download the little sample file they have, plug in names, dates of birth, just upload the file, save that group name, run the search. That can be useful, especially if you're a delegate user that's trying to run, all the requests for a day or a week or something like that for someone. Or if you're a prescriber and just want to do sort of a year-end review, there's a way to sort of run all of those searches all at once. Those searches, when you do a bulk patient search, go into this other tab, the bulk patient search history. You'll see each one of those loaded in there. You can always go back into that and view them later. Essentially, the request history is going to summarize all of the searches that you or your delegates have done. If you do have delegated users, it's important to be verifying that they are only accessing the PDMP for your current patients. You can verify that here. You can also download this as either a PDF or as a spreadsheet, CSV format. Then there's the PDMP prescriber report. So this is something we've been sending out for quite a while, since really February of 2018 was the first one that we sent out. They've gone through some changes, and they are now a fully interactive report. So you can no longer just receive it as a PDF. You can download it as a PDF, but you do have to go into the PDMP web portal to view your prescriber report. You can essentially click on any of these sections. There's a section regarding your opioid prescribing or your buprenorphine prescribing as it compares to other prescribers that have selected the same specialty that you selected in your registration process. The other lower portion of that covers sedative prescriptions and stimulant prescriptions. Also a section here on potentially at-risk patients. So there's a section for potentially dangerous combinations such as benzo and opioid co-prescribing, either where you wrote both of those prescriptions or you wrote one of those prescriptions and someone else wrote the other one. You can also see patients that had 5 or more prescribers or 5 or more pharmacies, or patients that have a daily morphine milligram equivalent of above certain thresholds. And again, you click on any of these sections, you actually view what prescriptions, what patients make up these potentially, high risk, or just if you want to look at all of your stimulant or sedative patient details, you can click on those sections to do that. There's also a feature in here where you can run a report of every prescription that's been reported to the PDMP under your DEA number. I think this is one that not as many people are aware of, but it can be quite useful, especially if you want to verify there haven't been any issues with fraudulent prescriptions or something like that. You have to put in a date range here, and I want to note that that uses the date written for the date range, not the date filled. If you're writing a controlled substance prescription that has refills, both that initial fill and every subsequent refill will all have the same written date, which is the date that you originally approved or authorized that prescription. And again, when you run those reports, it will go into this MyRx history where you can view that report. You can download that information either as a PDF or as a spreadsheet as well. And there's also the patient alert menu. So the patient alerts are something we send. We don't send very many of them in the grand scheme of things. There's usually about 40 or 50 patients that will meet the Board of Pharmacy's confidential multiple provider and multiple pharmacy threshold, which if you prescribed or were a pharmacy that dispensed a prescription to a patient that meets that threshold, you will receive a patient alert. Just want to note those alerts are not stating that that patient is blacklisted from receiving prescriptions. We're not telling you you can't prescribe to them. All we're doing is saying, please review this patient's prescription history and the PDMP and make sure everything seems appropriate. If you have any concerns there, you can coordinate with the other prescribers or not contact the pharmacies there to sort out what's going on, sort out any concerns that you might have, but we don't make any judgments about you receiving. We don't make any conclusions about you triggering a patient alert, and those are confidential notices that we don't share with anyone else. Just want to quickly also note the user profile. There's some key features in here for users. The My Profile page lets you update some information, but if you need to add a new DEA number or need to change a primary contact phone number, you'd have to contact us for assistance with that. The specialty section you can make changes to. You can add multiple specialties, but in terms of that prescriber report, it's only going to be your primary specialty that's used for those peer comparisons. And I just want to note, if you do go in and make a change to your primary specialty, that won't retroactively change the specialty on your previous prescriber reports, but your next prescriber report or scorecard that you get will be comparing you to that new peer group. You can download or print this account detail page if you want to copy, documenting that you are registered with PDMP. I will advise that our licensing boards, if they do essentially receive a complaint against a practitioner, they will try to verify that that person is registered with the PDMP. That's really the extent of what they can do outside of subpoenaing the records. And if they find that someone's not registered with the PDMP, they will send a 30-day notice and ask that you get registered within 30 days, provide them with proof that you're registered, and then they'll just outright dismiss that. So if you are someone who ends up getting that, downloading this PDF here is an easy way to document that you have registered with the PDMP. Also at the bottom of that My Profile page lets you update or add a mobile phone number or change your login email address. It will just ask you to enter your current password before it lets you do that. And there is also the delegate management menu. So this delegate management menu is where you'd manage all of your existing delegates. You also have the ability, if someone's already registered as a delegate user for someone else, that you as the supervisor can actually just go through this add button and enter their login email address. That'll add them as your delegate as well. But that only works if they're already registered with the PDMP. If they're not already registered with the PDMP, they'll go through that registration process and submit that request over to you for approval. And you'll see them listed in your delegate management menu. You also get an automated email letting you know that there's a delegate pending your approval. You'll see those delegates there. And again, you have to approve them, you have to reject them if they're no longer authorized. And then if you don't do the re-verification of those delegates in February, in March, they'll get kicked back to pending status. And you'll just have to go in here and decide if you want to re-approve them. Again, the delegate My Profile menu, at the bottom of that menu, you can actually add additional supervisors as well. So this is after you've already registered and have an active account. You can go into this delegate or to your My Profile menu and add additional supervisors later. And then just finally want to note the password reset process. Again, passwords are valid for 1 year. You'll get automated emails, I believe, at 14 days, and then around a week from expiration, they'll start sending you more frequent emails that your password's about to expire. If you enter your login email address there, and if you have a mobile phone number on the account, it will give you an option of texting you a code. Otherwise, it will just send you an email to reset your password. Just want to also note that our PDMP training website, Colorado PDMP tutorials, user guides, and webinars, is where we will be posting a copy of these slides as well as a recording of this webinar. And there's also some older tutorial documents that go into more detail on a lot of those key functions and features that I talked about and on the registration process. So more resources available there if you have further questions. And this is our contact information. So if you need to contact the PDMP administrator, our phone number is 303-894-5957. Generally, either myself or our administrators, Gina Sanchez and Tim White, should be able to take your call between 8 a.m. and 5 p.m. Monday through Friday. If for some reason you have to leave a voicemail, we're generally able to get back to the same business day. And then our email address is pdmpinqr, like inquiry at state.co.us. So you do need to contact us if you need to update your PDMP account. So change your login email address, most typical issue, and we do have to verify your identity, and we do need to speak to the user. So we won't be able to do that if you had someone on your staff call and try to do that on your behalf. We would speak to you to validate you. If you have any other kinds of questions or need any other assistance, please feel free to contact us. Patient matching issues, can't find a prescription in the PDMP that you think should be there, all that type of stuff. Contact us. Our vendor does have 24/7 support, but we can really only provide general assistance to confirm that you're registered or what your email address is, give you some general troubleshooting, but they can't make any changes to your account. So that's all I've got. I'll go through some of the questions that we have here. Question if there's any use requirement on stimulant medications. There's not a PDMP use mandate for stimulant medications, but we do highly recommend that you do check the PDMP before you write any controlled substance. And I'll let you know that you do have the authority to check the PDMP for any current patient. It doesn't have to be at the time of prescribing medication. Question on how long the history of patients who were checked by the prescriber stays in the PDMP website. The data retention policy is essentially 7 years. So you can go back up to 7 years on that. I know it's at least 7 years. I don't recall because our PDMP Aware web portal has actually only been active for 7 years and 1 week. So I'm not sure if things over 7 years on your search history will stay in there longer, but it is at least 7 years back, which after 7 years from the date fill the prescription from the PDMP as well. A question on if there's a requirement to report suspected substance abuse. The PDMP can't really do anything on someone expressing concerns about a patient who may be abusing controlled substances. We can't put that type of flag or notice in the PDMP. If you're seeing the other prescribers who also prescribe to that patient, you can coordinate with them about concerns, but there's not really anything that we could do regarding suspected substance abuse. Question on if you're a new nurse practitioner and don't have your NPI, but have your initial license, if you can still register. Essentially, as long as you have an active DEA license and an active Colorado Prescriptive Authority license, you can register as a nurse practitioner. And once you have that DEA license, that is when the registration requirement comes into play. If you don't have an active DEA license yet, there is the ability, but not the requirement, to register under that prescriber without DEA role. As far as your NPI number goes, that's not a required field on the PDMP account. So we don't require the NPI. It's primarily used as a validation credential with respect to the PDMP on those integrated connections through like the PDMP Gateway service. Some of those vendors will send your NPI number as a validation credential for you. So we do highly recommend if you have an NPI number to have that on your PDMP account. We are finding as we've gone through the requirement to validate each individual user who's using that PDMP Gateway service, we've had to go in and add NPI numbers to accounts. But we recognize not everyone has one, which is why we don't have it as a required field. give it just another moment or two. I think I've covered any questions that I could answer here in our webinar. There are questions on, let me see what else I can do. So Gordon Mannon had a question: if a physician were performing a Department of Transportation, FMCSA medical required a medical exam to access the PDMP and to assist in performing the respective employee's fitness for duty examination to drive a commercial motor vehicle. Essentially, if it is a current patient of the practitioner, you're authorized to access the PDMP. In terms of how the current patient is defined, the medical board does have a statement on when they consider that relationship to be initiated. Can't really go into further medical advice or practice opinion or legal advice on that, though. The question of, is my practice assistant permitted to access the PDMP account, my PDMP account, on my behalf in the course of authorizing referral requests? Someone like that can be a delegated user, but they're not able to log in using your account. It is important that a delegated user is accessing the PDMP under their own delegate account. There's a lot of functionality that we just talked about that's available to prescribers that's not available to those delegated users. So, if you take a look at our end user license agreement and our disclaimers, you need to make sure that you're not sharing your password and credentials with anyone else. And any of those delegated users need to make sure that they're using and accessing the PDMP through their own account. Not seeing any new questions come in. So I think we will now conclude this webinar. I do want to thank everyone for attending today, bright and early on a Friday morning. Again, we will have the slides posted to the Dora PDMP training webpage by the end of today. We'll have a webinar recording posted here, most likely by the end of next week. And just lastly, I'll throw this slide up so you can see the Dora PDMP website, our PDMP tutorial, you guys on webinars page, web portal, and then also that recent legislation that's made effects with the PDMP. Thanks, everyone. Really appreciate it. Again, feel free to follow up if you have questions. And again, if you are looking at claiming credit for your substance use prevention training, the Zoom account essentially records everyone that attended and for how long. So we've got a copy of that we'll be storing. And if you, again, get audited to provide documentation that you did complete the control or substance use disorder prevention training requirements, just let the board know that you attended this, and we'll be able to validate that through that list of attendees. So yeah, thank you, everyone. Take care.